hand mic over here, so you might want to give me a little bit of room. But want to wish the people of the city Happy New Year. I didn't expect that the first briefing of the year would be COVID again, but I want to let the people of Detroit know what's going on and what options that you have. So here is the positivity rate of COVID testing across southeastern Michigan. And what we saw through really November and into December was about a 15% positive rate, which basically means about 1 out of 6 or 7 people who went in to get tested positive. In just the last 2 to 3 weeks, that number has gone from 15% to 33%. That's a growth rate that we haven't seen before, which means across southeastern Michigan, 1 out of 3 people who go in to get tested are coming back positive. You know this from the people you're talking about, your friends, your family. Let me show you why this has happened and talk about what we're going to do at the city to help continue to keep you safe. So where we were in December, we were talking about the Delta variant. And so Delta was basically a pandemic among the unvaccinated. And people have chosen, for whatever reason, not to be vaccinated. But you watched what happened, and if you were like me, you'd been vaccinated, you got your booster, you wore your mask, you were living life normally with really no fear. You were safe. The pandemic was raging among the unvaccinated. And the unvaccinated were in November, December 10 times more likely to be hospitalized or die than those who had the vaccines. But what we saw is that the potency of the original vaccines diminishes over time. We've talked about this. Most people got vaccinated January, February, March, April of last year. And after 6 months, you were seeing that the effectiveness of the vaccine was wearing down. And what was happening was after 6 months, people were starting to get sick again. Now, if you've been vaccinated, it was past 6 months, it was likely to be a mild case, very unlikely to be in the hospital, but people were starting to get it. And that's when the boosters were rolled out. And the boosters were enormously effective, almost for sure. Kept you from getting the Delta variant, and in the rare case you did get it, it was a mild case. We were in good shape, and my guess was by the middle of January, the end of January, we'd have been talking about COVID in the rearview mirror. Something's dramatically changed, as everybody knows. Now we have a new variant. The Delta variant is still here, but it's on its way down. We're having a positive result there. But as everybody knows, the Omicron variant has showed up. And it's 3 times as transmissible as Delta. So if the average person who had Delta infected 2 people, the average person who has Omicron affects 6 people. That's kind of where we are. It is spreading faster than anything that we have seen. And even people who have gotten a booster are, in some cases, getting the Omicron virus. It is enough different that the booster doesn't give you complete protection. If you've got the booster and you get it, you're almost certain to get a very mild case. But unlike Delta, the booster does not completely protect you against the Omicron virus. Now, another thing that we're seeing, which you haven't seen before, this virus is evading the cloth masks. Those masks you made up yourself out of cloth or that you wore that had nice designs on them, they were very effective for the last year and a half in protecting you against infection. They aren't working against the Omicron virus. And so now we need to be wearing the K95 or the surgical masks. We have to take this more seriously. We're just going to have to adapt our strategies to what we are seeing. So, given that, what are we going to do? We actually were not doing a lot of testing the second half of last year, maybe 100 or 200 people a day, and they were easily accommodated. Now, you're seeing across the country, people standing in line for 5, 6 hours, even in some of the suburbs, people standing in line for hours to get a test. And today, the city of Detroit is acting to make this the easiest place in the country for you to get a COVID test so you can keep yourself and your family safe if you're positive. And so we are making these options available to you right now. And we have started now, we have opened 2 rapid test centers for Detroiters where you can get your results the same day. 2 places where you can go in and do that. Denise Fair and her team have already supplied 41 nursing homes and senior facilities and 10 homeless shelters with 8,000 rapid tests. What's happening now is with our most vulnerable population in our nursing homes, in our homeless shelters, they're being tested regularly so we can catch this early on and we can avoid the kind of tragedy that's been seen in a lot of other places with nursing homes and homeless centers. And so those folks are being protected with rapid tests, and we're operating 12 vaccine booster centers across the city. And the good news is we've seen double the number of people coming in for vaccines. So there's something they should have done close to a year ago, but at least we're seeing now an uptick in vaccinations. Let's talk about the rapid test sites, because this is what's on the mind of everybody I talk to. How do I get a test and get the results quickly? So our new sites are now taking 1,000 appointments a day. Same telephone number we've always used, 313-230-0505. You can call it right now. We will book you for tomorrow. 1,000 appointments today. You don't have to stand in line. We will move you through efficiently. One of the sites is the Joseph Walker Williams Rec Center that's on Rosa Parks north of Grand Boulevard. It's where we've been operating since we shut down the state fairgrounds a year or so ago. Monday through Friday, 7 a.m. to 4:30 p.m., you can go there and get your test. Today, we're taking you inside. Over the next couple of days, we're going to convert it to a drive-through site to move you through even more quickly. What will happen is you will come up, you'll get swabbed, and later on that day, usually in an hour or so, you'll get a phone call with the results. You won't have to wait 3 or 4 days to find out the results. You'll get that the same day. That place can actually handle about 600 tests a day. That wasn't enough. We felt like, looking at our phone calls, we needed 1,000 a day. So we have now opened up a second site. What we all used to call the TCF Center has been renamed Huntington Place. But our convention center downtown is now open Monday through Friday, 9 a.m. to 5 p.m. And so you just dial the one number, 313-230-0505. They will tell you what time slots are available for Joseph Walker Williams Center. They'll tell you what time slots are available for Huntington Place, and you can pick a slot. This works just like it did when we used it for the vaccines. You will drive up, you'll get swabbed, you'll drive out, and you'll get a message very shortly after on whether you are positive or negative, but we're not going to have these kinds of lines. And so we want you to know right away, are you COVID positive or not, so you can take the actions both to get medical care for yourself and to protect your families. What do you need to get a rapid test in the city of Detroit? 2 things. Make the appointment, because we are operating an appointment only now. If we don't operate on appointments, we're going to have 400 people show up at 9 in the morning, and we'll have the same kind of lines you've seen other places. Make your appointment, you'll be booked in, and you won't have a significant wait. And then second, you have to live or work in Detroit. This is a program for Detroiters. Suburbs have lots of their own programs and the like, but you're going to have to show that you live or work in Detroit. If you do, the rapid testing is available for you. And our vaccines are available Monday through Saturday at our 12 sites you can find on the city website. And if you've been vaccinated but you haven't been boosted, really, you are so much safer if you get that booster shot. And of course, if you haven't been vaccinated in the first place, you are very vulnerable. Your city government is working. All of our city offices are staying open to the public. And If you look at what happened in South Africa and other places where Omicron hit early, it peaked in about 3 or 4 weeks and started to come down. Whether that remains true here, we'll see. But if it is, it'd be somewhere around the middle of January that it would peak, which means we are going to be dealing with this through January and almost certainly into February. Our offices are open. I go to work every day, so does everybody in my office. We sit 6 feet across from each other. We wear our masks. We're careful. What's different is that this morning at 9 o'clock, we have our weekly cabinet meetings. Normally 40 of us would be sitting in a conference room. We can't have 40 people sit in one room for an hour. It's just not safe, even with the fact everybody's boosted and wearing a mask. And so those kinds of meetings we're doing on Zoom. But your city offices are all open. They're working their regular hours. The people of this city are going to work for you. And again, I want to thank the city employees. I know they're taking the proper precautions to keep themselves safe. Your city council, I want to say congratulations to the new council president, Mary Sheffield, the new council president pro tem, James Tate. But if you saw the council meeting yesterday, the city council and all the other boards and commissions must meet in person. The state law that allowed the council members to meet by Zoom was rescinded by the legislature effective January 1st. So our city council members and our boards will be in person. They will sit there. If you saw the meeting yesterday, we had a plastic glass between our council members. We'll do the same thing for our boards and commissions. So they are going to have to sit in person. However, as the public, you don't have to come because Denise Fair, the health director, has issued an order that all of the public meetings will be done on Zoom so that you as a citizen can participate, make your public comment, ask your questions, and continue to watch as you did. There are a handful of seats at the site. If you want to actually go sit there at the meeting, you can, but we do not want to put our residents' health at risk just to be able to participate in a public meeting. So all of the public meetings for the next 3 months will be on Zoom, and you will be able to participate without having to physically come down. So what happens if you go in, you show up, and you test COVID positive? I'm going to turn it over now to our medical director, Dr. Rob Dunne, who guides every single city employee who tests positive and guides each of them on their care and options, and he's going to talk to you about what happens if you test positive. Dr. Dunne?
All right, thank you. That's a great summary about what's going on right now. But what happens when you test positive? We all know people that have tested positive recently and family members. So first, keep in touch with your doctor. There are a lot more treatments that are available right now. Many of you have heard about the new antiviral treatments. Those are available through your doctor for certain patients with certain conditions. Talk to your doctor, especially if you're getting sicker. Most people do very well and have mild symptoms, but if you're getting sick, stay in touch with your physician. It's always the question about when you can get back to your regular activities after you test positive. And what it really comes down to is whether you have symptoms or not. If you're COVID positive and you have symptoms, then you're going to stay isolated until your symptoms are gone for at least 24 hours. We are really encouraging people to get a test to confirm that they are no longer contagious at that time. We have testing resources available, and that is absolutely the safest method. That's what most places, including the city of Detroit, have used for our employees. And then you can get back to your regular activities. Again, most people do very well. If you're positive and have no symptoms, which can happen to about 20 or 25% of people, you need to isolate for 5 days because we don't really know exactly when you became positive. So we don't want you spreading that disease to other people. And then get a second COVID test to confirm that you're negative after that 5-day period. And then you can get back to your regular activities. But this is why we want you to get out and get tested. Denise?
Thank you, Dr. Dunne. So you have, you've heard from us, and you're probably wondering, what can you do now? So I'm glad you asked. What you can do is get vaccinated. Anyone ages 5 years and older in the city of Detroit is now eligible to get their vaccine. And we know, Getting vaccinated is what's going to keep you protected, but don't stop there. We want you to get your booster shot, and that will help to provide a second layer of protection to significantly increase your immunity. We're also asking you to follow COVID-19 protocols by avoiding large crowds, social distance, and wear your mask. These are guidelines that we have been telling you over the last several months. Now, there have been new guidelines encouraging you to wear a surgical or a KN95 mask and not the cloth mask. And here's why. We know that cloth masks, they worked for a while, but as the mayor said, they don't work any longer, and we want you to stay protected. The cloth masks absorb moisture too quickly, which lessens the protection against Omicron, which we know is 3 times as contagious as previous variants. So please go to your local pharmacy. You can find the KN95 masks there, again, which will keep you protected. So we're still in the middle of a pandemic, Detroit, and it's really up to us. If we want to get back to normal, if we want to stay safe, these are the tools that you will need in your arsenal to keep you safe. So again, getting vaccinated, getting your booster shot, getting tested, and following the protocols, and also wearing your N95 mask. And with that, I'll turn it back over to the mayor.
So the real news is today, if you can get your test at your drugstore, your Myers, or wherever, your doctor's office, that's great. But if you're in the city of Detroit, 1 phone call, 1,000 tests a day, we'll get you in the next day or so. And with that, we'll take any questions.
Good afternoon, Mayor Andre, Michigan Chronicle. We've seen over the past few weeks across the nation a supply shortage with testing. Is that the case, or how will the city respond to any shortage situation? Is that the case in Detroit?
So we don't believe, we think at 1,000 a day, based on our phone calls so far, we're fine. So you look at what we've done, it was kind of ironic to see some criticism over New Year's about the fact that we bought tests ahead of time, but we have a supply of 4,500 Abbott ID Now tests a week that we run through our labs, and we got those locked in and guaranteed on top of the other supplies. So we're good. And if a week from now we need to get to 1,200 or 1,400 a day, our problem is not the number of tests. Our problem is getting the staff out to do it, and we will. But we think at 1,000 a day, we will be fine in the city of Detroit.
Okay.
What are the projections you're looking at as you plan for the coming weeks, not just right now? And how concerned are you about hospitals within the city and their ability to handle the sick?
Well, I am concerned that when we had the crisis hit in March and April of 2020, we had more than 1,000 people hospitalized in Detroit. Today, we've got 500, and that's leveled off over the last 3 days. And so it's a strain. I mean, the folks in the hospital are doing a great job, but it's not the 1,000 that we had nearly 2 years ago. If it levels off at 500 and comes down, if you talk to the hospital administrators, their biggest issue is not they don't have enough beds. Their biggest issue is their staff are out sick, and they need people to care for them. So I am concerned about it, and we got great hospital systems. They're managing, I think, very competently right now, but they're under a lot of pressure, and we all owe a debt of gratitude to the men and women working in those hospitals every day.
Hello, Mayor. 2 quick ones for you. One more of a question, the other I'm interested in your comment. But do we have any word on police fire, whether there's issues of a certain number out with COVID or on quarantine that you might have available?
Chief White can give you the number. We do have officers out. It's nowhere near what it was 2 years ago. It's nothing we can't manage, but he's got some office folks in cars, and you should ask him that question. We've had some pressure on the EMS side, and they have drawn from different groups as well. But you'd have to ask the individual departments. At this point, it isn't anything we can't manage. 2 weeks from now, we will see how we are. We've got pressure on the dispatch side. But we've lived this before. I mean, this is nothing like March and April of 2020. But it's something that we keep an eye on every day, and I know Chief White is totally on top of it. He tells me that things are stretched, but okay.
When you mentioned we've lived this, it kind of pertains to what I'm interested in getting your thought on. Because across the border, we see Ontario locking down for 3 weeks. You've talked about, if things hold true on the pattern of Omicron, that it could be mid-January. Our state may not have the palate for being able to do business shutdowns again. We're approaching this differently collectively. Just curious your thought, given in Canada, obviously, they've gone a different direction, and maybe we're not being as assertive as some feel we need to be, kind of throwing that at you.
I just tell you, I go to work every day. I got a booster shot. I wear my KN95 mask. I go, yesterday I had lunch at a restaurant, go to shops. I think that if you've got your booster, you're doing your KN95, you're not in large groups, I think you can live a reasonably normal life right now. That's the choice I make. Each person makes their own choice, but I don't see a need for any kind of a shutdown, but I would like to see more people getting boosters, and I would like to see people wearing the masks. And we are seeing a lot more people wearing masks. That's an encouraging thing.
Thank you.
Following up on the EMS, fire, and police impact, has the city decreased any of the random testing on those staff? We heard some reports of that. They're still being tested.
Every 2 weeks, everybody who has not been vaccinated is tested every 2 weeks, and then there's a random test for those who are, and they're being done. Police and fire are done here. The other city employees at Eastern Market, before the week's over, we'll be consolidating a lot of those tests at TCF as well, but we have not backed off on the every 2 week testing for non-vaccinated employees. And I'm glad to say more employees are getting vaccinated, so it's taking some of the pressure off.
And what's the cost of these programs, and does the city anticipate that the federal government will reimburse the city?
Yeah, these are all federally funded COVID responses, and so that has not been an issue. Funding has not been an issue. We've had the resources to do everything that we want to do. And as I say, city services are not shut down. Now, may that change in the next 2 weeks? It might, but right now we're doing okay.
Mayor, we've got a couple of questions from Christina Hall at the Detroit Free Press. She wanted to know if someone could speak to which tests are being administered at the different locations, whether PCR, antigen. PCR tests are being done at the Williams Center, and the antigen tests are being done at TCF. Okay. Also, any thought about a mask mandate in the city, or is that something that would come from the city?
I think that needs to come from the state of Michigan. I don't know how you have a mandate in Detroit and not in Highland Park and in Ferndale and not in Royal Oak. So we will follow the state mandates, but I think at this point, common sense would say that you're wearing a mask. Certainly, if you're inside around other people, at this point, it's pretty foolish not to have a mask on.
Okay, and last question from Christina. The vaccination rates in the city are still lower than some of the surrounding areas, and wanted to know thoughts on that, if that's impacting the infection rate and if there's efforts to increase the rate.
My job is to give Detroiters options, and there is no place in the country it's easier to get a vaccine or it's easier to get a test, and that's what we are doing as a city, and people are making their choices. We've had some tragic losses for people who, the heartbreaking story. I've had two families tell me about a husband who, on his deathbed, as he was taken off the ventilator at the end, apologized to his family for not having been vaccinated. Some of this arrogant, I don't need a vaccine thing changes when you're gasping for breath and on a ventilator. But all I can do as the mayor is make the vaccines easy for you. There are 12 sites 6 days a week, make the tests easy for you, and you've got the best medical guidance. But at the end of the day, people are making their own choices and are living or in some cases not living with those choices.
Okay.
Anything else? All right, thank you very much.